If your doctor told you to get your blood pressure down to 120 over 80, that advice was not wrong. But here's something most appointments never have time to cover. After 60, chasing that number could be quietly working against you. In 2017, one guideline change moved the goalpost from 140 to 130. Overnight, roughly 31 million Americans went from normal to hypertensive. That single decision may be shaping your prescription right now, and nobody asked whether it was right for your body at this stage of life. Quick thing before we get into it, drop your country in the comments. I spend my days in one small community clinic, so it honestly gets me every time, seeing how far past that little waiting room this reaches. I'm Dr. Kemi Lawson, 15 years now, mostly in a community clinic, sitting across from people over 60 all day long. High blood pressure, pills with side effects nobody ever walked them through. And here's the thing that got to me. I kept watching folks head out the door with a prescription in hand and almost no idea how to actually protect themselves. There was no big dramatic moment, just that same gap over and over until I couldn't let it sit. But 120 over 80 has an origin story. And once you know who changed that number and why your body after 60 plays by different rules, you will never look at that cuff the same way. There is also a measurement problem that affects nearly every person over 60, and your doctor's office may actually be part of the cause. I will get to that. But first, I want to know who's out there. Type 1 in the comments if you're on one blood pressure pill or none at all. Type 2 if you're juggling 2 or more. Stick your age next to it if you don't mind. I read every one of these, and it tells me a lot about who I'm making these for. Now, let me take you back to where this whole thing started. For decades, researchers studied large groups of adults and found that people with blood pressure around 120 over 80 had fewer heart attacks and strokes. So that became the gold standard. Simple enough. But here's what almost nobody explains. Most of those early studies were done on younger adults. Adults with healthy kidneys, sharp minds, and no long list of medications. Not someone who is 68, managing diabetes and a thyroid condition, and already taking 3 pills before breakfast. And then 2017 happened. The American College of Cardiology and the American Heart Association updated their guidelines. They moved the definition of high blood pressure from 140 over 90 down to 130 over 80. One stroke of a pen. And suddenly, about 31 million Americans who went to bed normal woke up hypertensive. Now, you might be thinking, is this some kind of conspiracy? It is not. The science behind the change was real. Lower blood pressure does reduce cardiovascular risk in certain groups. That is not in dispute. But here is the key. That guideline was built on data from specific populations, healthier populations, and it was applied broadly to everyone, including people it was never tested on. Think of it like a shoe size. If researchers measured 1,000 feet and found that size 8 fit most of them, that does not mean size 8 fits you, especially not at 72 when your feet have changed shape, you have bunions, and you have been walking a lot longer than most of the people in that study. The system is not evil, but it is built for averages, and you are not an average. So the real question is not whether 120 over 80 is a good number. For some people, it absolutely is. The question is it the right number for your body right now at this point in your life? To answer that, you need to understand what actually changes inside your body after 60. And this part matters more than most doctors have time to explain. After 60, your arteries stiffen. That is just biology. Think of a river that has been flowing for decades. The riverbed gets harder, narrower, less flexible. The water, your blood, has to push harder to get where it needs to go. Your brain depends on that pressure. Your kidneys depend on it. So what happens when you cut it? There is a term for this, cerebral autoregulation. Sounds like something out of a textbook. Actually, it is out of a textbook, but what it really means is simple. It is your brain's ability to manage its own blood supply. When you are young, your brain handles pressure dips easily. The blood vessels flex, they adjust, no problem. After 60, that flexibility is not what it used to be. Your brain actually recalibrates. It starts relying on a slightly higher pressure just to get the same blood flow it always needed. So when a doctor pushes your numbers down toward 120 Chaktis because the guideline says so, your brain may not keep up. And here is what that feels like. You get foggy in the afternoon. You feel dizzy when you stand up in the morning. You are tired even after a full night of sleep. You feel off. Not sick exactly, just not right. And when the pressure drops too fast, say when you swing your legs out of bed and stand up, something genuinely dangerous can happen. I will explain exactly what in a moment. But the point right here is this: your body recalibrated. The guideline did not. The system gave you a number based on someone else's body, and your body has been trying to tell you it does not fit. Okay, so if the guideline was built for a specific group, who exactly were they studying? That is worth knowing. In 2015, a major clinical trial called SPRINT studied over 9,300 adults. Average age 68. They split them into two groups, one targeting blood pressure below 120, the other below 140. The group aiming for 120 had fewer heart attacks and cardiovascular deaths. Real result, not in dispute. And from that moment, a lot of doctors started pushing harder for that lower number in their older patients. But read the fine print. SPRINT excluded anyone with diabetes. It excluded anyone who had already had a stroke. It excluded people with advanced kidney disease, and it excluded anyone with significant frailty. So who exactly were they studying? The healthiest, most resilient older adults. Not the typical person over 60 dealing with 2 or 3 conditions and a handful of prescriptions. And even within that carefully selected healthy group, the lower target caused more dizziness, more fainting, more kidney problems, and more dangerous drops in blood pressure when standing. You might be thinking, so were the studies wrong? No, they were incomplete. They answered a narrow question for a narrow group, and then that answer got applied to everyone. A second large trial, the STEP trial, done in China in 2021 with over 8,500 adults aged 60 to 80, showed similar benefits for lower targets. But again, the side effects in real-world patients were real and significant. The takeaway is not that lower is wrong. It is that lower is not automatically right for everyone. There is a big difference. All right, so how do you know if your target is too low? Your body is already telling you. Most people just do not know what the signals mean. Remember when I said something genuinely dangerous can happen when your pressure drops too fast? Here is what that looks like. You stand up in the morning and the room tilts. That rush to your head, that brief spinning, there is a name for it. Orthostatic hypotension. It means your blood pressure drops too fast when you go from lying down to standing. A meta-analysis published in the Journal of the American Medical Directors Association found this is associated with a 73% higher risk of falls in older adults. A fall at 70 is not a bruise. It can mean a broken hip, a hospital stay, or worse. Then there is the fog, that fuzzy, slow feeling you have been blaming on bad sleep or just getting older. Your brain may not be getting enough flow, and the tiredness, you slept 8 hours and woke up drained. That is not aging. That is pressure too low for your organs to do their job. You might also notice you feel unsteady on your feet, not quite dizzy, not quite solid, like the ground is a little uncertain beneath you. Or your readings regularly dip below 100 systolic, even if the average looks fine. Those dips are a red flag. Here is what all of these have in common. They are not side effects of getting older. They may be side effects of a target that was built for someone else's body. The system handed you a number. Your body is telling you whether it fits. Makes sense, right? So the next question is, what is the right target? In a moment, I will show you exactly which profile fits you and the number range that goes with it. Quick pause. If any of that sounded familiar, if you just recognize something you have been feeling, hit that subscribe button. It takes 1 second and it genuinely helps this reach more people over 60 who need to hear it. All right, here is the framework. This is the framework many cardiologists now use when they sit down with their own patients. Not the system's default, here's a more honest version. It is built around 3 real profiles. If you are between 60 and 79, you walk regularly, you are mostly independent, and you do not have major conditions like advanced kidney disease or dementia, a target below 130/80 is appropriate. The cardiovascular protection at this level is real, and the risk of side effects is relatively low for someone in your position. But what if your picture is more complicated? Maybe you are in that same age range, but you are managing diabetes, kidney issues, or you are already on 3 or more medications. Maybe you sometimes feel lightheaded or unsteady. For you, the safer target is between 130 and 140 systolic. Pushing below 130 in your situation may cause more harm than benefit. The European Society of Cardiology now says that blood pressure targets in older adults should be individualized based on frailty, kidney function, and how you actually feel. Not a single number for everyone, 80 and older. The research here is very clear. A systolic target between 130 and 150 is considered safe and appropriate depending on how you feel day to day. If you are at 125 and feel completely fine, no dizziness, no fog, no fatigue, some additional heart protection may be there. But if you feel even slightly off, your body is telling you something. Listen to it. And look, if you are sitting there thinking, I do not know which one I am, that is completely fine. Most people do not until they sit down and actually look at the full picture. That is what your next appointment is for. We are not treating a number on a machine. We are treating you. Now, here is the part almost nobody talks about, and it could be changing your numbers without you even knowing it. Here is something that affects a huge number of people over 60, and it rarely gets discussed. You check your blood pressure at home, 126/78. Perfectly fine. Then you walk into the doctor's office, sit in that chair under those fluorescent lights, and the cuff reads 155/90. Suddenly, you are being told your medication needs adjusting. That gap has a name: white coat hypertension. Your blood pressure spikes because you are in a clinical setting, slightly nervous, slightly rushed. It is not your real number, but it may be the number deciding your prescription. So, what do you do about it? Track your blood pressure at home for 7 days. Same time each morning, same arm, after sitting quietly for 5 minutes. Write down the number and how you feel. Dizzy, foggy, fine, energized. Bring that log to your appointment. And if the office reading seems high, ask them to take it again after you have been sitting for 5 minutes. You can also ask for a manual reading. Sometimes those are more accurate. The number your doctor sees should be your number, not your nerves talking. Okay, so now you know your profile and you know how to get an accurate reading. Here is what to do with all of this before your next appointment. 3 things. Simple, specific, and they will change the quality of your next doctor visit. First, know your profile. Go back to those 3 profiles. Be honest about which one fits your life right now. Not the life you had at 55, your life today, your activity level, your conditions, your medications, your symptoms. Write it down, take it with you. Second, track how you feel alongside your numbers. For the next 7 days, every time you take a reading, write down how you feel in that moment. Dizzy, foggy, tired, fine. A week of real data from your body is worth more than a single reading in a clinical setting. Third, ask one question. Sit down with your doctor and say, given my age, my conditions, and the symptoms I have been tracking at home, what is my personalized blood pressure target? Not the guideline average, my target. You are not overriding the system. You are bringing better data to it. That is a different kind of conversation, and any good doctor will welcome it. All of that sounds reasonable on paper, but paper does not bleed. Let me tell you about Marlene. Let me tell you about someone I will call Marlene. 74 years old, retired seamstress, lives in a small town in Tennessee with her son a few blocks away. She had been on blood pressure medication for about 8 years. 2 pills, then 3. Her doctor kept adjusting, kept pushing for that 120 target, and Marlene hit it. Her readings were sitting around 118/72. On paper, beautiful. But Marlene did not feel beautiful. She felt exhausted by 2 in the afternoon. She was foggy, forgetting where she put her keys, losing her train of thought mid-sentence. She blamed it on age. Her doctor did too. Then one morning, she stood up from the bathroom, got dizzy, and went down, fractured her hip. 3 weeks in the hospital, 6 weeks of rehab. Her son had to move in for a while. When the cardiologist at the hospital reviewed her case, he asked one question: why is her systolic this low? He raised her target to 134, adjusted her medication. Within a month, Marlene was walking on her own again. The fog lifted. She told me something I wrote down on the spot because you do not forget it. I really believe that was just my age setting in. Nobody ever said the pills might be doing it to me. And then there is Frank, 69, retired mechanic from just outside Kansas City, still picking up weekend shifts at a hardware store because his words, sitting around, makes him feel old. He came in convinced something was seriously wrong. Terrible every morning, shaky, could not trust his legs until noon. His doctor had him at 118, chasing that 120 target. We sat down and went through everything: his kidney numbers, his medications, how he actually felt day to day, and agreed on 136. 2 weeks later, he called the clinic. Doc, I woke up and made breakfast standing up. I have not done that in a year. Marlene was not sick. Frank was not failing. They were being treated like averages. All right, one more thing, and this one you can start tonight. The system's default answer is another pill, but your body has a few tools of its own, and unlike a prescription, these come with almost no downside. Bring them to your doctor as conversation starters, not replacements. Hibiscus tea. Here is how it works. The anthocyanins in hibiscus act like a natural ACE inhibitor, relaxing the walls of your blood vessels. Think of it like loosening a clamp on a hose. A clinical trial found 3 cups a day for 6 weeks lowered systolic pressure by about 7 points. Wild, right? That is not nothing. Some medications do not do much better than that. You can find it in most grocery stores. Brew it, let it cool, drink it through the day. Second, magnesium. Specifically magnesium glycinate or citrate, about 400 milligrams a day. A meta-analysis of 38 trials found that at this dose, it can lower systolic pressure by roughly 5 to 6 points over 3 months. Oh, one more thing on this one. If you are on a diuretic for your blood pressure, you may already be low on magnesium without knowing it. Worth asking about. Third, a 20-minute walk every day, not a jog, not a run, just a walk. The cardiovascular data on this is overwhelming and it costs you nothing. You deserve tools, not just a target. So you have your profile, your tracking log, your questions, and a few things you can start tonight. Here is what all of that adds up to. Getting your blood pressure target right after 60 is not about a number on a chart. It is about standing up in the morning without grabbing the wall. It is about a mind that is clear before your first cup of coffee. It is about being steady on your feet when you walk across a room. It is about being fully present with the people who matter most, whether that is a grandchild, a partner, or a close friend. You have spent decades taking care of everyone else. The least you deserve is a number that actually fits your body, not a guideline written for someone half your age with half your history. The system gave you a default. Now you have the data, the questions, and the tools to make it personal. The number on that cuff is not a verdict. It is a starting point for a better conversation. And now you know how to have it and what to bring. If you have someone in your life who is managing blood pressure, send them this video. It might be the most useful thing they watch this week. Subscribe if you have not already, and hit that notification bell so you do not miss what comes next. Actually, speaking of what comes next, we talked today about finding the right target. But what if one of the medications you are already taking is quietly making things worse? I made a video on exactly that. It is right there on your screen. Watch it next.